everyone. This is Dr. Mangar, and today I'll be sharing with you about Jeune syndrome. Thank you to Dr. Lewis for helping to prepare this presentation. Jeune syndrome is a rare autosomal recessive skeletal dysplasia with multi-organ involvement. It's also known as asphyxiating thoracic dysplasia, and it's a chondrodysplasia that resembles Ellis von Creville syndrome. And so it's part of a broader category of thoracic insufficiency syndromes and ciliopathies, as we will come to explain. And with Jeune syndrome, patients often have shortened limbs, a narrow thorax, and progressive kidney problems. Jeune syndrome is estimated to occur about 1 in every 100 to 130,000 live births and does not appear to have any ethnic or racial predilection. And newborn infants will usually present with a long, narrow thorax, and so they'll have respiratory insufficiency and associated hypoplasia of their lungs. A lot of children die in this neonate period due to respiratory failure. So the hallmarks of Jeune syndrome are extreme constriction and narrowing of the thorax. Patients will often have shortened ribs, and they can have variable shortening of their limbs with abnormalities of the bones of their pelvis and their extremities. Now, the thorax is relatively immovable, and the ribs are horizontally directed and they're short. And so, with the thoracic abnormalities, oftentimes they have limited ability to expand when the child inhales. And so the child may breathe rapidly and shallowly and can be susceptible to frequent respiratory infections. This also causes hypoplasia of the lungs and respiratory distress, which can lead to early death. And almost half of the deaths occur between 6 months and a year. In patients who have Jeune syndrome, they may also have renal abnormalities, as many as 40% of patients, and they may develop renal failure later in their life. So it may be during infancy or up to the second decade of life. And for patients between the ages of 3 and 10, renal failure is unfortunately one of their leading causes of death. Some patients who have Jeune syndrome also have been reported to have intestinal malabsorptions and hepatic dysfunctions as well. As we mentioned before, patients with Jeune syndrome may have shortened limbs, and sometimes they may also have polydactyly, as you can see here in the clinical photograph. One important feature of Jeune's with the thoracic constriction is that it can also result in increased pulmonary vascular resistance and contribute to cardiac problems as well. Some patients have abnormalities in their dentition and retinal degeneration also. As we mentioned before, Jeune syndrome follows an autosomal recessive inheritance pattern, and the genes that mutations are found in are many, but include these listed here. And what these genes have in common is that they encode intraflagellar proteins. And so defects in the primary cilia in these patients have been found sort of at the heart or at the reason of this syndrome. With the disturbance in the primary cilia, chemical signaling pathways are often altered, and part of it is still unclear how these mutations can lead to some of the skeletal abnormalities that are found in these patients. Thankfully, being a genetic disease, DNA testing can be done as early as 14 weeks, and some things can be diagnosed prenatally on ultrasound as well. With regard to treatment for patients who have Jeune syndrome, the main target, especially in the infant period, is focused on supporting their respiratory function. Spirometry is often used to assess their pulmonary function, and These patients, because they often present with respiratory distress and recurrent respiratory infections, we have to treat these respiratory infections vigorously with antibiotics, sometimes endotracheal suctioning, and postural drainage. Sometimes mechanical ventilation is required to support these patients. But it is very sad that 60 to 80% of these cases tend to be fatal in early childhood. However, if these children can survive the early years, their respiratory problems tend to decrease with age. And we will talk about some of the surgical options that can assist them as well. So, surgery often is required for the most severe cases of Jeune syndrome. And usually, surgery will involve expanding the thoracic cage with sternotomy and fixation or bone grafts. And early intervention surgery will have to be updated to accommodate for the growth of the child. Sometimes, for these patients, they may require NG tubes to assist with feeding. And one thing that will be absolutely important for patients and parents will be genetic counseling. An example of a prosthesis that's used for these patients, it's a vertical expandable prosthetic titanium rib. Now, as we look at some of the orofacial manifestations for patients who have Jeune, it's not necessarily a clear, consistent path of what the abnormalities may be. This clinical photo is showing a patient who has multiple missing teeth. So here, this patient has hypodontia, which can be one of the characteristics. Um, as a guide, achondroplasia and Ellis van Creveld have dental and craniofacial features, and so some of them could also be present with Jeune syndrome being a similar chondrodysplasia. One of the big things that we need to think about is that patients who have Jeune syndrome are absolutely not candidates for in-office conscious sedation, and that's due to the plethora of respiratory difficulties that they face with constriction of their thoracic cage, their shallower breathing, their higher incidence of respiratory infections. At baseline, they also have lower O2 saturations, and there could also be a possible contraindication with the use of medical restriction devices due to the limited expansion of their thoracic cage. And for these patients, the medical burden that they have very early on in their lives is very high, and so dentistry and preventive care can sometimes seem to fall to the wayside for parents who are having to deal with wondering if their kid is going to make it through the infant period. So, being as supportive as we can with preventive tools will be key for these families. Um, Definitely want to send out a medical consult with specific questions about any respiratory issues. As we mentioned, the possibility of renal issues, hepatic issues, and sometimes with the constriction of the thoracic cage resulting in cardiac issues. So we do definitely want to follow up if they're seeing specialists and get a sense of their stability and any precautions that we would need to take. So this is something that we would have to work side by side with their physicians and specialists as they grow and as they continually their status continually evolves. Thank you guys so much for your attention. And here are the references used for this presentation.